Hey, Dr. Fisher here again, and this is another addition to our series of frequently asked questions. And this question, fantastic question, we hear this all the time. What types of problems or conditions can fissure traction help with? And I'd say probably the number one is degeneration. And what degeneration is, you can see here, this is what a normal vertebrae should look like. And over time, after wear and tear or injuries, the discs start to degenerate or dehydrate. And that's called, you may have heard the term spondylosis or desiccation. Basically, all it is the dehydration and the wearing down of your discs. So what fissure traction does is it helps to either maintain the fluids in your discs, or in some cases it can help rehydrate the discs. That's what decompression does. That's the attempt of decompression. So that's probably the number one thing, and it can help prevent degeneration too by combating against gravity with our negative G-force technology. Okay, now next huge one, disc bulge or disc herniation or protrusion, and hopefully you can see this here. Okay, that's mimicking what a disc bulge or herniation looks like. It bulging out and pushing up against the nerve. All right, so disc bulge, herniation, protrusion, and you might have seen on MRIs, 1 millimeter, 2 millimeter, 3 millimeter, 4 millimeter, something to that effect. Okay, and that again is that disc protrusion, bulge, or herniation. Okay, muscles. Okay, fissure traction, because it helps to elongate and pull on the spine. It helps to stretch the muscles that support your spine, so it can help with sprains, strains, muscle spasms, pulls, or trigger points. What people usually allude to are like the knots that you feel up in your traps or in between your shoulder blades and scapulas. Okay. Also too, fissure traction helps with flexibility, so it helps to increase the range of motion of our joints, which are back in here. These are what we call the facet joints. So when fissure traction pulls and elongates the spine, it helps stretch the capsules of the facet joints. So if you've been in a car accident or you've had some type of trauma where you've had extension of your neck and it jams those joints together and they're injured at all, fissure traction can help to pull and stretch those capsules, which works with the facet joints. So it can help in the flexibility of your joints, muscles, helps decrease stiffness, increases ranges of motion, and obviously the more frequently you use it, the more it stretches, the more it decompresses, then the greater the ranges of motion you can get at not only the muscular level, but the joint level. Now, another big one, you might have heard the term, maybe your doctor has told you that you have this, lateral canal narrowing or stenosis. And typically what that means is, here, this is the lateral canal. It's the side opening where the nerves come out, just like this right here. You can see the nerve coming out of this lateral canal. Well, when that canal narrows, okay, then it can pinch down on the nerve. So typically they go hand in hand. When you have a lateral canal narrowing or stenosis, you get nerve compression, pinched nerve, sciatica. You may feel numbness, tingling, maybe muscle weakness or atrophy. So what fissure traction does, as it decompresses and pulls and opens up that lateral canal and gives that nerve some relief, it helps to mitigate the compression on the nerve. It helps to open up and get, the nerve can get more blood supply. It can temporarily eliminate numbness and tingling. And in some cases, if it can help to eliminate the disc bulge or protrusion, then it can permanently help with the numbness and tingling. And the stenosis, it can open that up and make that larger, okay? And of course, obviously, with all of these problems together, they kind of add up and they cause you some type of pain or discomfort. So as fissure traction treats all of these different causes, it helps with the effect of eliminating the pain. It can give you better alignment, helps with your posture, helps get rid of tech neck. And what we're going to do is we're going to swing right over here and we're going to look at these x-rays that I have on my x-ray screen. And this is a very, very common situation we have now today, where someone who's on the computer or on their smartphones all the time like this and bending forward just like I'm doing, just very similar, you can see how the curve in the neck is actually going the opposite direction. We want the curve going back this way, like with me, the curve going back this way. So we eliminate this tech neck, because what this will do is in time, it'll cause the degeneration or dehydration or desiccation of the discs. It can cause narrowing of the canals and cause the discs to fail. So fissure traction, as you may know already, in our technique is you're in extension of the neck. You also maintain extension in the low back. So it helps promote the natural curve that we're supposed to have, and where other traction units actually cause your neck to go forward like this, or it just pulls it straight, but it doesn't help increase the curve that we need naturally. So pretty much we've hit the majority of all the different conditions or problems that fissure traction can help with. So hopefully you'll give it a try.